I'm joined by Josh Armistead-Wood. Josh is the founder of Troglo. Josh, it'd be great if you could introduce yourself and just say a thing or two about your journey to creating Troglo.
Sure. I'm Josh Armistead-Woods. I'm the CEO and founder of Troglo. So essentially, I got involved and interested in sexual health, partly as a biological sciences student at university, and partially as I am a member of the LGBTQ plus community. And so sort of those two things tied in together. So from like the HIV/AIDS crisis, its transmission, and that from like a biological standpoint, and then the social implications of that, and then sort of like the sort of like knock-on effects that there still are in the community today regarding HIV. And so what really came about was I had a conversation with a couple of friends regarding HIV when I first came out, and I noticed that there were um, so many like inaccuracies in the information and the knowledge that they had surrounding it that there really needed to be some work done in terms of like making access to that information more freely available, rather than as it currently is in many cases, whereby it is very scientific and clinical. And so what we're looking to do at Troglo is how we can sort of personalize information around sexual health and well-being. So that's everything from HIV, AIDS, STIs, all the way through to mental health and the implications of that on sexual well-being. And so, yeah, it all sort of ties in together. And what we've done is develop Troglo, which is a sexual health data analytics platform that works to facilitate improved decision making for individuals, and on a larger scale works to help healthcare providers better deploy their resources to aid in minimizing the social and economic impact of poor sexual health and well-being.
From a user perspective, could you just say a thing or two about how Troglo works?
Yeah, sure. So from an individual basis, what a user interacts with is the Troglo platform, which is a mobile app through which they're able to log sexual activities. And the goal there is that we can give them a completely unique and individual experience based on the way in which they've interacted with that sexual activity. So, for example, that could be having them score their mental health and safety and satisfaction scores for that interaction, or it could be about the risk score associated with the sexual interaction they had. So, the idea there is that we have a very basic interface that allows the user to log that information, but then on the back end, we have like far more complicated analytics that allow for the interaction itself to sort of be broken down to like key constituents. Um, and then from that, we are allowed to give insights that are personally tailored to that individual user. So that could be something as common as the way in which you have met this, say, casual sexual partner is detrimental to your mental health. And we can see this through this big trend of activities that you've had over the last 3 to 9 months, let's say. And the idea there is that we can hold a mirror up to an individual with their own data to essentially help them make better decisions going forwards, with the goal of minimizing the effect on their mental health, and also minimizing the detrimental health risks of poor sexual health and well-being.
So, what have you built so far, and what have you learned from that development process?
Yeah, so we at the beginning of this year we ran a beta trial of our initial platform, which was a very sort of basic, bare bones tracking platform, which was just a very sort of simple web app. And so we used that to sort of do some more advanced user testing, which was essentially like how will people interact with logging information and what sort of information do they want out of it. So we had a fairly consistent like back and forth with the users that we selected for that cohort. So that was the first thing that we developed. And so from that, we've used the insights that we gained from our users and also sort of the technical know-how that we sort of developed from that, to sort of like lean into the development of the new platform that we're building, which is a more advanced actual mobile application. So it's an iOS and Android app. And so from that, what we've been able to do is highlight the types of insights that are more relevant to individuals. So that's things such as activity logs and ranging over time, all the way through to specific headspace and mental health characteristics of the individual and how they change over time. So there's sort of been that continuation of like development of the product and expanding on it. But then also from that, what we've learned from it is how can we sort of make an interaction with Troglo more beneficial to the user. And the thing that's come up time and time again on that is really about creating like unique experiences. So for example, one thing that we're doing to sort of capitalize on that is by using the Troglo risk card, which is essentially the way in which we illustrate risk and mental health and those types of things and how they're all interconnected within Troglo. But what we've made it is rather than having a single number or a very obvious indicator, we've turned it into a combination of colored shapes that sort of blend together to give the indication of like risk rather than a very sort of informative number. And the idea there is to provide a feeling when someone uses the platform rather than just a simple statistic. And so what we found from that is it's far more engaging for the individual user. So there's a lot more elements of that we've like integrated throughout the platform, of where we can create feelings and emotions with the platform rather than just insights and statistics. And what we found is that's far more engaging to users.
Brilliant, thank you very much. And as a business, how do you generate revenue?
So as a business, we are going to be generating revenue in sort of a couple of different ways. So in the near term, we're looking to partner with local health authorities. So that really comes into licensing out the Troglo platform and integrating it with services. So for example, allowing individuals to book through the platform so they can book certain sexual health tests, or we can allow for them to communicate more securely with individuals. So that's something that's like particularly of use to members of minorities. So for example, within the LGBTQ plus community, what we find is that people who are not out yet are far less able to access correct services to them because they're unable to be honest about who they are with strangers when they go into a sexual health clinic, for example. And so that creates a really big issue regarding them not receiving the correct services that would be required for them. And so by using a mobile platform like Troglo, not only do you have like the cost benefits of being able to scale much more effectively, but you also have like the ability for a patient to stay as anonymous as they need to whilst receiving that high level of care, with still allowing the sexual health services to connect with the individual people who need those services. So it's about how can you communicate the right amount of information to make both sides comfortable and effective. And so that's what we're looking at doing with like local authorities. And then in the more long term, what we're looking at doing is how we can anonymize and take key indicators of information that we're collecting through the platform. And then we can use that to generate models that will allow for like higher level healthcare providers to actually like providing them with tools that will allow them to analyze the trends within sexual healthcare, predict and prevent like the outbreaks of future STIs. And more generally, we can look at how we can make it more cost effective for them to deal with these issues on a much larger scale, whilst also creating a more geographically non-exclusive form of sexual healthcare. So whereby someone in Scotland is able to access the same levels of healthcare that somebody would be able to in central London, which is really important because those needs are pretty like universal, but are currently at the moment are very much geographically separated, which is obviously a huge issue when it comes to like providing people with like a high level of care. So yeah, there's a couple of different elements there, and it's really about how we can monetize like the data side of it whilst maintaining like that user safety and security at the high level, and then at the low level we can provide value on a region by region level to those healthcare providers.
Cool, thank you very much. And what's on your immediate horizon as a company?
So in the next 2 months, we're looking at launching the first full version of the Troglo product. And we're looking to build out some more partnerships with universities, also local authorities, to sort of provide the most benefit possible to the community with the Troglo platform. So I think it's really about the launch, which is the main thing that we're focused on at the moment, and then sort of like expanding like our user base as quickly as possible to provide that benefit.
And looking a bit more to the long term, what kind of scale or impact ambitions or areas and stuff do you have in mind?
So on a longer scale, we're really looking at like what areas can really be affected the most by what we're doing. And I think like the really like beneficial part of Troglo is because we are a mobile platform, mobile first platform, and because we are trying to provide something that is entirely scalable, there isn't really any like limitation on that. Language is one of the only things that's really limiting like how we can interact with things due to interact with different like geographies due to the way in which like colloquial language sort of varies for discussing sexual health and well-being when you want to do it on like a companion and friendly level. But what we're really looking at is how we can like develop our Troglo platform into areas that really need that additional care in sexual health. So that's really looking into regions outside of the UK. So the US, for example, is a really clear example because sexual health costs are like exponentially higher than they are in Europe. And so by having a platform like Troglo that enables people to take ownership of their sexual health and take control of the information surrounding it, what we're really doing there is enabling people to lower the costs of sexual health like considerably. And then you can also do that in like more remote areas. So you can look at countries in Africa where HIV is quite a considerable issue. By allowing someone to take ownership of the data surrounding their sexual health and well-being, and also by tapping into access of like amazing resources that are available in like scientific papers and peer-reviewed studies, what you're really doing there is you're like providing more universal access to resources that are currently reserved for like the very few who have the ability to pay for those papers or are at university or are like doing PhDs and researching this stuff. Like it's not something that people are able to like access and like utilize themselves. And so what we're doing is bring those resources down, and the goal is to spread it to as many people as we possibly can.
Brilliant, that's exciting. And what are your kind of major priorities for us right now? Like, how could people get involved and help out, whether it's users or investors or connections or anything like that?
So the main thing that we're looking for like now is really how we can build out some really strong partnerships with local authorities, with social organizations that are working in this space. But also it's like about spreading the word about like sexual health and well-being, about how it's not something that should be taboo anymore, but for some shocking reasons still is. It's really about, yeah. So the main thing for us is it's building those partnerships to make sure that we can provide as much benefit to our users as possible. So that's everything from like charitable organizations that are working in this space all the way through to university societies who have some element of mental health and sexual health and well-being elements, all the way through to local authorities that are looking at ways of reaching more people within their communities.
That's excellent. Thank you very much, Josh. Thank you for your time. It's great learning about Troglo, and all the best.
Great. Cheers, well.